What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on this Tuesday, April the 25th. It's always a pleasure to have you with us today. And I've got two of my friends with us talking about good dental hygiene. We have Dr. Phil Batson and Dr. Elizabeth Abe. Good to have you both here from Columbia Healthy Smiles.
Thanks for having us.
And, you know, we've covered a gamut of topics with dental health. But I thought today maybe just some of the simple things that questions that people would ask. And number one, what type of toothbrush and toothpaste should I use?
That's a good question, and we get asked that a lot. Our recommendation is an electric toothbrush, number one.
Why an electric toothbrush?
Just like all things with technology, you know, it can do it better than we can manually.
Yeah.
And now they have timers built into them, so it really keeps people honest for brushing for those 2 minutes.
Yeah.
When people try to time themselves and do it with a manual toothbrush, studies have shown the average time that they actually brush and think it's 2 minutes is about 30 seconds.
That's what I thought.
So they rush through it. But the electrics just do a great job cleaning. If you think about when you get your teeth cleaned by the hygienist and when you go into your dental visits, you know, it's like getting getting something close or similar to that. With that spin brush every day if you're using it.
You know, it took a long time. Now, your dad was my dentist for many years before you, and he kept telling me about the electric toothbrush, and I thought it was just a lazy way of brushing your teeth. And I used to just always brush by hand. Finally, when I decided to go ahead and break down and buy the electric toothbrush, it was night and day difference as to how your mouth felt after the teeth were brushed.
Oh, it really is.
Yeah, I mean, they feel clean. I can't imagine going back to just brushing. But if some people still are not sold on an electric toothbrush, if you're brushing manually, you don't recommend using a hard toothbrush, do you?
No, not at all.
Why is that?
Softest bristles possible. And that's just for gentleness to your gums. You don't want to have excess gum abrasion with a stiff bristle brush. And in all honesty, plaque on your teeth, the film, the biofilm and plaque, that stuff's really soft and mushy. Soft bristles can get it cleaned off. If it's anything harder that's stuck on your teeth, an electric brush or a manual aren't going to get it off, and that's what the hygienist will get it off at your cleaning.
So then why do they even make those really hard bristle toothbrushes?
Sure.
No, maybe people need to clean their grout with it. I'm not sure.
but don't buy the hard, buy the soft bristle.
Get the soft bristle, yeah.
Yeah, and with the electric toothbrush, it's soft bristle, isn't it?
Yeah, and they do have different settings on them. Some of the brushes have different settings, so you can do a lighter setting, even if you're like highly sensitive or you're worried about it. You can do even a gentler setting with the electric brushes. They have some customization built into it.
Okay, what about toothpaste? Is it okay to use whitening toothpaste, or does that damage the enamel?
It doesn't damage the enamel, but it's not our first recommendation usually. Whitening toothpastes are more abrasive than other toothpastes, and so if people already have sensitivity, that's not a great option. And the whitening toothpaste, they just really kind of scrape away some surface stain. But we recommend anything that's as least abrasive as possible. And if you're going to do whitening, there are other ways to achieve probably better results than just
with the toothpaste. What about brushing with baking soda? Now, a lot of people swear by that.
A lot of people swear by it.
But it's also abrasive.
But it's also very abrasive.
Baking soda is very abrasive?
Yeah.
Mm-hmm. Okay.
So they probably like the feeling from it and the foaming, but it's not our first recommendation.
Okay. All right, now, Elizabeth, I'll ask you about the next one, flossing. Do we really need to floss? If you've got an electric toothbrush, is flossing necessary?
Yeah, because even with an electric toothbrush, it can't get between your teeth. So that's where flossing comes in. Also, it can't get into the gum areas between your teeth, and that's really important for that. But of course, there is a proper way to floss that can be taught by your hygienist or when you go into your dental visit, because just popping the floss in and out isn't necessarily doing what the floss is intended to do and how you should be doing it.
So when you're flossing, you're breaking loose any plaque that is in between the teeth, right?
In between, and then also going underneath your gums a little bit.
What about the electric toothbrushes that have they say they have the little flossing tips on it? Does that do just as well as manual flossing or not?
Well, it might get some areas between your teeth, but it's not going to actually get anything out from in between your teeth.
What about with Waterpik? Does that take the place of flossing, or you still say you still need to floss even if you use a Waterpik?
We definitely recommend water picks for some patients, especially patients that have food traps or implants or things like that. But getting that space, like right where your teeth contact, is often where cavities develop, and so that's where floss comes in.
So there is no alternative to flossing. Even if you use an electric toothbrush, if you use the Waterpik, you're still saying floss.
Yes, but
Okay.
correctly, and of course, if a water pick is what you're going to use, then that's better than nothing.
Okay, all right, got it. And let's talk about mouthwash or mouth rinse. Is that good for your mouth, or can you overdo it with it?
Yes and yes.
Yeah.
Kind of like toothpaste. There's a whole host of mouthwash products out on the market, and they're marketed, in various types of ways. But for the most part, our mouths have good and bad bacteria in them, and we really want to nurture the good bacteria and try to keep the bad bacteria at bay. So you don't necessarily want to take a mouthwash that kills everything because you're wiping out good bacteria at that time. But a lot of these mouthwashes, yes, they can help clean up, if you have, breath issues, bacteria build up on tongues, things like that. But also they put fluoride in some of the mouthwashes, which can help remineralize the teeth and keep teeth strong and help with sensitivity.
If they have fluoride.
If they have fluoride in it. Some also help stimulate salivary flow, with patients with dry mouth, things like that. The big recommendation we give for patients if they're going to use a mouth rinse is to find one without alcohol in it.
That's what I was going to ask you. About the alcohol, and do most mouthwashes have alcohol in them, or
there's a lot more in the market now without them. The alcohol burning is kind of a placebo effect. It doesn't clean any better than the ones without alcohol.
Okay, so when you're looking at mouthwash, look for mouthwash without the alcohol.
Yes.
We're out of time, but if there's something you'd like to hear or talk about, you can give them a call at Columbia Healthy Smiles, and your number is
573-875-7071.
Okay, all right, and no pain dentistry there. We're out of time. We'll see you tomorrow. Bye-bye.